We often say that patients, that we don't want to be maternalistic or paternalistic with regard to care, but with your own experience, did you feel that you were proactive, that you needed to be proactive in some way? Did you need to be proactive with your cardiologist or with any other physician that was involved in your care, or do you felt that the doctors made recommendations, but the recommendations themselves were not particularly absolute, they were just recommendations? Because one of the issues that we have from patients, they're feeling so terribly overwhelmed that we're not quite sure what to do. You're here to give us the information, tell us what to do, yet there are patients who feel just the opposite, as you did, which is, I know my body, I know how I feel, I know what kind of quality of life I would like.
Right.
Do you gel with what my needs? And I think that's where we get into some discussion.
Well, yeah, you really hit the nail on the head. So you engender a lot of confidence, and so sorry, that's just the way it is. But that's what I built my foundation on. So I don't spend a lot of time reading about the details because I'm working with an award-winning team that understands all of this. So I'm not coming in with a great deal of questions in terms of comparisons between therapy 1 versus therapy 2. What I am looking forward to do is to try and be the best patient that I can be. Listen to what my physicians are saying, ask them questions so that and point out, well, I'm experiencing this, so that you're not in the dark. So when for instance, the Lee Jones lab, when my physician at Corning, the Corning Incorporated physician, and you both were seeing that I was making progress on getting my body turned around, I got a referral to the Sloan Kettering Lee Jones lab, and I got a chance to meet Lee. And his cardiologist...
For our audience,
yeah.
Dr. Jones is an exercise physiologist with a lot of experience in exercise physiology in breast cancer patients. And we've been trying very hard to have our patients be seen by him, but you managed somehow to get to him before I could even get to him.
I know, I felt bad about that because Dr.
Okay.
Schubert basically just all of a sudden I was there and it's like, I hope Dr. Slovin approves of this.
Well, enlighten us about your experience and how important it was.
It was amazing. So the catch is that they really liked what I was doing with weight loss and diet and so forth. And then the cardiologist ran the stress test on me. And then I'm sitting across the desk from him and he said, I don't like your EKG. And I said, but here's the thing. At that point, I think I'd taken off maybe 50 pounds. And my resting heart rate had gone from 76 to 46. And I was really feeling pretty good about myself. And he said, okay, you're an athlete with an EKG I don't like. And I said, okay, what do we do next? And then we did nuclear scans and some other things. And he came back and said, all right, so I know I don't like your EKG. You've got 3 coronary arteries that have extensive calcific plaques. So we got to get to work on this. And so I said, what are we going to do? And because basically I've got experts to talk to. So he said, well, you need to be on statins. In fact, you should have been treated for the last 30 years at least. And so we're going to put you on statins. And he said, the next time you come back, and I know he was just kidding for the audience, but he said, I'd like to see your cholesterol and triglycerides to be 0. I didn't quite get to 0. I apologize when I came back for my next checkup, but I did get my triglycerides from 320 down to under 100. And
that's amazing.
Yeah,
that's
60,
absolutely
80.
amazing.
I got my cholesterol from 280 down to under 100, and I got my HDLs up to nearly 50. So you can do it, but again, it was a surprise to me. Here's this heart thing, and here's my dad who died of a heart attack. The only thing I didn't do that he did was smoke.
Well, I think you've been very fortunate in having a cardiologist who, number one, knows the literature and knows everything, but did he ever discuss with you about the role of androgen deprivation therapy in cardiovascular risk? Because we often find that cardiologists and even internists don't seem to have the scope of knowledge as to what hormonal therapy will do. We know that it does put people at higher risk. A lot of our patients are older than 65, so there's inherent cardiovascular risk, but what do you do when you know there's risk? And it's been untreated for a number of years, and how do you really deal with it?
He was concerned about the stability of the plaques, and he was cognizant of the implications of the ADT.
Right.
But what he was basically having me do is he said, well, as far as the exercise point, what kind of exercise are you doing, how much are you doing, what's your pulse rate, and so forth. So we made sure that was right. And then the next part was, and the duration of the exercise. And
Well, you had told me something that Dr. Jones says that
Yeah.
you were overdoing, and you may just want to.
Yeah, so the physiologist mentioned, so I'll put it on the table. So I swim 30 miles a week, and I do about the same distance on treadmill and so forth. And when I was in that phase, I was burning just under 5,000 calories a day to take weight off. And so we were trying to be careful of my heart, and I was doing a type of exercise also called HIIT. So it's an interval type of training thing which puts the heart under more stress. So anyway, as we were going along with that, one thing that my heart would do is it would throw something called a preventricular contraction. It would throw PVCs. And so we came to a good discussion point, which is how often, at what level of exercise would I work? I wasn't looking for a straight number I'd hit. So when I'm doing all of my swimming and so forth, I swim at the level just below throwing PVCs. And as he said,
I don't know how you do it, but that's great.
No, it's the nice thing about swimming.
Yeah.
It's pretty easy to control, how hard you're swimming. And so that's worked very well for me. I've only had one incident where I wound up with heart and no issues out
I mean,
of it.
I have to salute your cardiologist for the level of aggressiveness in which he pursued your treatment and immediate control, because I think one of the issues that we face is how often should people be monitored for cardiovascular issues while they're on androgen deprivation therapy. I think all of our patients tend to think that we are the internists and therefore we should be the one-stop shopping, and they don't realize that as good as we all may be, we don't really have the nuances regarding hypertensive management, especially cardiovascular. I think even in monitoring patients who are on ADT, we as medical oncologists don't often say every 3 months, let's run your lipid profile, let's look at other factors that are very important. And I think that's because we assume that the internist or the cardiologist does it, but I do think that there is probably a breakdown in our communication with these doctors, because I don't think they realize very often that we are increasing the risk of cardiovascular, or what we call major cardiovascular events in these things.
He urged me to be careful, and so I would follow the criteria that we came up with. And as you said, the physiologist was particularly concerned about the fact that I wasn't working out every other day. And I said, well, so here's the thing. In the first 5 months, I went from, I believe would be called stage 4, because I had distant metastasis.
That's correct.
And then when you scanned me through radiology in May, all the mets in the vertebrae in my spine and lymph nodes were gone. And so that was just about the time that I was talking to Lee and the cardiologist and so forth. And I said, well, here's the thing. I know that the studies are showing maybe 180 minutes a week of aerobics is considered a game changer in favor for people with breast cancer and the other thing. But in my case, I said, I think that I'm not going to change anything because it's working for me. I enjoy feeling younger. I mean, I feel at least 20, 25 years younger than I started. And I'm back to the same size I was in 1974. So
amazing.
It's completely remade my life, and I think, you know what, I think I don't mind exercising a little extra. My joke for the audience is that my little friends don't take a day off, so I don't. And my little friends are, of course, the cancer cells. So why should I give them a break? If I don't feel, like if I'm coming down with a cold or something, they're not taking the day off. I don't either.